I'm Lisa Welsh, the communication lead for My Sexual Health, and today I'm delighted to be joined by Dulce Mbiza, who is a professional nurse who works in aesthetics and also sexual and reproductive health. Welcome, Dulce.
Thank you so much, Lisa.
It's an absolute pleasure to chat with you today, and especially because you are the first recipient of the My Sexual Health Scholarship for the My Sexual Health Team Accreditation. We're so delighted to have you on board. We would love to just chat a little bit about the work that you're doing and how this scholarship will help you.
Oh, thank you so much. It's an honor. I feel so privileged to have the opportunity to join the team and to have this chat with you. I am so excited.
Thank you, Dulce. We will be so blessed to have you as part of the team. I have no doubt. Just looking at a little bit of your background, and that's what we want to get into today. So I
Yeah.
would want to just ask you if you could share some of the problems that you've seen in teaching and supporting sexual health in South Africa, and maybe especially with teenagers and young people, because I know that you work a lot in that area.
Yes. So, as a youth nurse, I think our culture and our religious backgrounds have formed this really huge barrier in the ability to communicate with young people about sex, especially because now the parents form a part of this barrier. A lot of people are very uncomfortable about their sexuality and they don't see their sexuality as part of like their health. And it's just kind of like separated as something else that's kind of like meant for the married, or I don't know who exactly, which demographic we believe it's meant for, but people are so detached from their sexual health, and a lot of people take a long time to access help when it comes to the sexual health and their sexuality, because so many things have been deemed as normal, and sometimes it's just like an embarrassment and a stigma to come out and say I'm experiencing this and I don't think this should be normal. And it's mainly because there is a gap in the education. I've had the privilege in high school of getting sexual education from a nurse who used to come in, but I'm aware that there are so many schools that don't have this privilege and that don't have that opportunity. And I think that is a huge gap. Yeah.
Absolutely. No, thank you for sharing that. I've made a note here that your vision includes offering sexual and reproductive health services by visiting people's homes and talking
Yes.
to them on the phone. So what do you think are the most important things that we can do to make this new approach work well in South Africa?
So I'm very passionate about mobile services and about allowing people to have this help in their homes. So when I was starting with youth friendly services, what I know for sure is that teenagers, and I know this spreads out to adulthood, sometimes when you walk into a facility, it almost feels like, especially when it's sexually related, it almost feels like it's written on your forehead. And also understanding that young adults, our lifestyles and our work schedule and the corporate culture doesn't allow people to actually access healthcare the way they should. And working in sexual health, it's not always something that you can have a telephonic conversation about. It's sometimes that it needs inspection, and I mean, depending on your accreditation and your qualification. But I believe that the ability to have someone coming into your home and assisting you with what you need, given it's a safe space. When you're in your home, it's already a safe space. Should you get a pap smear and you kind of feel like you were invaded, you can quickly hop into your bathtub and kind of like wash it away. And so for me, it's about accessibility, it's about convenience, and it's about creating a really safe space for people to get that assistance and things like that. So yeah, I'm very passionate about mobile health, but I'm also aware that in the economics, it's not everyone that can actually afford to have people come into their homes, and our home situations are not the same. There's a lot of people in the township communities that are living in one room. It's not even a one bedroom. It's like a one room setting that is a kitchen, it's a lounge, it's a bedroom. And in that setting, you're also dealing with the perpetrator that is living with you. And so to access that kind of help is a little difficult to get it in the comfort of your home. But I really believe that in the setting, in the clinics, in those spaces, youth friendly services are really important, and they need to be highlighted, because I know in a lot of clinics they have their youth zones that are time framed. So they will have their youth zone maybe from 2 p.m. or 3 p.m. where the kids come out of school. But I really believe it should be a full day thing. And when I was working in the Walmer Township and we finally opened the doors to have youth friendly services, I was seeing the youth from early in the morning till 4 p.m. like for till the last minute the clinic is open. So surely the time space that is given to the youth to access these services shouldn't be limited, but also having the ability for people who can afford it to have people to come to their homes to assist them should also be accessible, in my opinion.
Yeah, thank you for sharing that. I'm curious to know, like, what did that look like? What was it about that service that you said that you had youth coming in all day? What was it that made it youth friendly from your experience?
Okay, so what happened is I went for a training and my lovely manager had selected me to go and do the training. So when I was attending the training, we were basically learning about what a youth-friendly service should look like, the demographics, the space, the time, and all of that. So then I went back to the clinic and I spoke to my team, and together we created a youth space. So for me in that clinic, the youth zone involved that the youth could walk in and out without bumping into auntie this and grandma that, and bumping into their mother. Because now if my mom's friend says they saw me at the clinic, my mom's gonna ask me what I was doing at the clinic if I'm not sick. And if you're going for contraceptives, it's like, oh, you're promiscuous, oh my god, yeah, all of that. Or if so that involved using a corner that was far away. It was lovely because the space allowed us to do this. So there was a corner where the waiting area was completely secluded. Like there wasn't any up and down happening. And right next to the corner was the pharmacy, meaning they could get help, go to the pharmacy, and they dash out. But also in my consultation room, I had some of the, especially the STI treatments in the room, so that I can like give it to you and you can take it and you can hide it if you need to, and you can go. But I think we're also wanting to work towards an environment where teenagers don't have to hide their contraceptives. Do you know what I mean? Like that's what we're working towards. But I need to understand that right now, culturally and demographically, that's where we are. So yeah, that's what the youth zone looked like. And next to my consultation room was an NGO that worked with the youth. So there were like social workers and things like that. It was just amazing. I loved it. I always thought what I always used to say is I wish I could take the clinic with me, like to come to Johannesburg, relocating. But that's what like the youth zone looked like. It's a safe space. Okay. There is not a lot of interaction. That it's a quick in and out. And what's lovely is that there was also an exit, so they actually didn't have to walk through the entire clinic. It was really a safe space that was created, and I'm glad that it's still going on, it's still growing, and that the person who replaced me is actually a good friend of mine, is also very well involved with the youth and very understanding.
So if there are any youth listening now who don't have access to something like that, what advice could you give them if they are seeking some kind of sexual health support?
So I would say the local clinics, if we're talking, I mean, it's unfortunately when you're giving these tips, you need to consider the demographics that you're talking to. So when we're talking to the poorer community, I know there are some youth services that exist in the townships, and sometimes they do face a barrier when it comes to communicating with healthcare providers. So accessing social work and in the local communities, but a local clinic is a very good space to actually access this help. But I would actually also say, like, getting on to my sexual health, like when I learned about my sexual health, it was like, oh my God, like sometimes I consult people and I'm like, go on to my sexual health and you will find people. It's such a safe haven. But I believe that with this, what I'm going to be equipped with, I would like to create more space for the youth to have access to a point where it's not even a question. In as many townships as possible, there is a safe space for teenagers to go, but also a space where that is not labeled sexual health, because now that is also will drive the people away. So holistic one-stop shops are really important for the youth in the townships. So for now, I would say the local healthcare centers are a good go to.
Amazing. Oh, it gives me goosebumps to kind of see your passion about this. So,
I love
okay, so
it.
I can see you too. What keeps you motivated? What gives you that passion to keep on working towards becoming a credible sexual health provider?
I think it's my passion. Like, I'm honestly passionate about the things I do. I'm passionate about health. But I remember the young me, how I grew up and how I viewed sex and how I viewed boys, and how now I can go back and trace it to the traumas that existed, prior to being introduced to sex as a whole. It's really my understanding of how important it is. Your sexual health and how you view sex really affects each and every aspect of your life. And I know some people don't think so, but sex is such an important aspect of your life that it actually affects your confidence, and it affects how you carry yourself. It affects how you interact with the men in your workspace. It affects how you interact with the men in your family. So for me, that is really that's what keeps me going. But having a support system like Dr. Alna is honestly like an angel from above. She's someone I can refer to, but also knowing that there's a team of people that I can work with, a multidisciplinary team of people. I'm also passionate about multidisciplinary teams in the school space, but that's a topic for another day. But knowing that there's assistance, that I can pick up my phone and call another fellow colleague in the same
Yeah.
space who knows more about different things than me, that just really gives me the comfort and allows me to keep going.
Amazing. So, Dulce, as you start this new phase of your career then, and you embark on this training and this
Yeah.
accreditation program, what is one aspect that excites you the most? Like, what are you most excited about learning?
You know what I always say, you never know what you don't know. I love education. Like, I'm one of those people. I love education. I love trainings because you always walk out with knowing something else. Like, from the first module when I was doing ethics, like learning things like, okay, for example, you'll have a client coming in and they have pre-ejaculatory problems and things like that, and when they leave you say thanks for coming. I would have never thought that would be inappropriate. I never thought that would be inappropriate, but the training equipped me with that. So I'm excited for each and every aspect of it. When I was learning on how to speak to children about sex and the importance of calling the vulva instead of a flower, because a child can come to you and say, uncle was biting my flower, and it's like, oh, okay, like, but each and every module, I'm excited for everything, because there's
Yeah.
always something I didn't know that I'm learning, and I know very little compared to what there is to know. So I'm just excited for everything. I'm excited to learn everything from module 1 till the end. I'm just excited. If I could do it in the middle of the night, I would.
Dulce, and we are so excited to have you here. So excited that you're the first person on this scholarship program to become accredited as a My Sexual Health provider. That is the goal, and we're so excited for that. We're excited
Thank
for
you.
your learning and to get to know you better with all of the knowledge that you have already, all of the passion and experience. Yes,
Yes,
you're going to make such changes in the world, and we're so grateful for that.
I can't wait. I am so excited. I really am, and I'm so grateful.
Thank you
Yeah.
so much for your time, Dulce. We cannot wait to
Thank
see what you get
you.
up to, and we'll
I'm
definitely
excited.
see that.
I'm so excited. Can't wait to complete the course and to pass on the knowledge and to recruit more alliances. Definitely.
Wonderful. Thank you so much.
Thank you, Lisa.